Look at your hands right now. Right now. Before you do anything else. 10 small plates at the tips of your fingers. Most people see cosmetics, maybe a chipped edge, a hangnail, something to fix before a date. I see diagnosis. 15 years of clinical practice, and I have watched lung cancer, liver cirrhosis, and severe anemia announce themselves on fingernails long before the patient felt a single symptom. In 2019, someone posted a photo of their nails online. Domed, convex, curving over the fingertip like glass. The comments flooded in. Genetics, take some vitamins, nothing to worry about. One comment was different. Get to an oncologist today. The person listened. Early stage lung cancer. Surgery. Alive. No blood test, no routine physical had caught it. The nails caught it a full month before any other symptom would have surfaced. That is not a feel-good story. That is a clinical fact. And it raises a question you should ask yourself right now. When was the last time you actually looked? The system you rely on for your health is not built to keep you healthy. It is built to treat you when you get sick. There is no billing code for prevention. Your next appointment will not include a nail exam. Subscribe to Dr. Hayes and hit like. I am telling you what they will not. We are on our way to 1,000 subscribers, and every single one matters. Before we get into specific signals, I need to demolish one myth that has been circulating since before your mother was born. White spots on nails mean you are low on calcium. You have heard this. Someone said it to you as a child, pointing at a little white dot on your pinky. It is not true. It is completely, clinically, demonstrably false. Research published in the British Journal of Dermatology, one of the most authoritative peer-reviewed journals in dermatology, has definitively disproven any link between those white spots and calcium deficiency. If you have been believing the calcium myth, you have almost certainly been misreading every other signal your nails send. And some of those signals are a matter of life and death. Literally. To understand why a nail is such a powerful diagnostic tool, you need to understand what it actually is. The nail plate, the hard surface you see, forms inside the matrix. The matrix is a tiny zone of living tissue tucked under the skin at the base of your finger, just beneath the cuticle. It is extraordinarily sensitive to everything happening in your body. Any disruption in metabolism, any nutritional deficiency, any inflammatory process, and it shows up in what the matrix produces. The plate changes color, shape, texture, and growth rate. It records your health history the way a black box records a flight. A full nail replacement takes 4 to 6 months on average. That means, right now on your hands, you are carrying a 6-month archive of what your body has been through. Every ridge, every spot, every shift in color is an entry. The only question is whether you know how to read it. 90% of the nail plate is made of keratin, a structural protein, the same one that makes up your hair. But the architecture is entirely different. In a nail, keratin fibers are stacked in layers like sheets of plywood, bonded together by sulfur bridges. Those sulfur bridges are what make the nail hard. Hair lacks them, which is why hair bends and nails do not. This also means sulfur is critical for nail integrity. If your diet is low in sulfur-containing foods, eggs, garlic, cabbage, the layers begin to separate. Splitting and peeling are the surface sign, but underneath that surface, the mechanism can be pointing to something far more serious than a diet problem. Between those keratin layers sit microscopic films of fat and water. They are what give a healthy nail its faint gloss and smooth feel. When the body is chronically dehydrated, as we age, the thirst mechanism becomes less reliable, meaning people routinely drink less than they need without knowing it. Those films thin out. The surface turns dull, develops micro cracks, loses flexibility. Most people blame winter or hand washing. The real cause is often sitting in a glass they are not filling often enough. Beneath the nail plate lies the nail bed, a thin layer of tissue threaded through with capillaries. Blood shows through it, giving a healthy nail its pinkish tone. The composition of that blood, the oxygen level in it, the concentration of hemoglobin, all of it is visible right there on your fingertip. Hemoglobin drops, the pink fades toward white, oxygen falls, blue-gray creeps in, bilirubin rises, yellow appears. Bilirubin is the breakdown product of red blood cells, and when it accumulates, it means the liver is struggling to clear it. 10 small screens at the ends of your fingers are broadcasting your body's internal state in real time. Most people do not look. Now, back to those white spots. The medical term is leukonychia, white nail. What you are actually seeing are microscopic air bubbles trapped between keratin layers during formation. Air, not calcium. Where do the bubbles come from? Almost always from microtrauma. You hit your finger on a table edge. You pushed the cuticle back too aggressively. You worked in the garden without gloves. The matrix took a small hit. 3 to 4 months later, exactly how long it takes for that spot to grow visible, you notice it and start worrying. The cause is long forgotten. But not all white marks on nails are harmless. If what you see is not isolated dots, but horizontal white bands running all the way across the nail, and you see them on several fingers at once, that is a different story. Entirely. Those bands were first described by a 19th century Italian physician named Mirk. They are called Mirk's lines. They can indicate heavy metal poisoning, chronic kidney disease, or severe protein deficiency. The difference between a harmless white dot and a diagnostic white band is like the difference between a scratch on your car and a crack in the engine block. They look vaguely similar from a distance. The consequences are nothing alike. If the entire plate has turned uniformly white, milky, opaque, with no pink showing through at all, that finding is associated with serious liver dysfunction. When the liver is failing, certain proteins accumulate in the blood, and the vascular pattern beneath the nail plate changes. The pink disappears. In clinical textbooks, this is described as one of the classic early signs of cirrhosis, the kind of sign that appears long before jaundice sets in or pain begins. The nail signals first. Now, look at the base of your nail. Do you see a white crescent? That is the lunula, and most people ignore it completely. It is the visible portion of the matrix, the growth zone. In a healthy adult, it is clearly visible on the thumbs and faintly visible on the other fingers. If it has disappeared entirely from all of your fingers, that can point to anemia, low red blood cell count, nutritional deficiency in the peripheral tissues, or a thyroid problem, specifically a sluggish thyroid. The opposite finding, when the lunula takes up more than a third of the plate, a condition called macrolunula, is associated with an overactive thyroid. One small crescent, two opposite diagnoses, the same landmark pointing in completely different clinical directions, depending on what you see. A bluish lunula is a rare but serious finding. It indicates excess copper accumulation in the body, a hereditary metabolic disorder called Wilson's disease. Without treatment, Wilson's disease destroys the liver and the brain. The first signal is quiet, sitting right there at the base of your fingernail. A red lunula points toward autoimmune processes, chronic heart failure, or carbon monoxide poisoning. Think of each shade as a warning light on a dashboard. Different colors, different systems, different urgency levels. Each one requires its own response. Now, let us look at the color of the entire plate. A healthy nail is pink, smooth, and faintly shiny. Any deviation is a message. Let us read those messages one by one. Yellow nails are the most common complaint I hear from patients over 50. The first cause is fungal infection. Onychomycosis. Organisms get under the free edge, break down keratin, and the plate changes color, thickens, becomes crumbly. Most people shrug it off. Looks bad, but not dangerous. That is a mistake. Fungal infection is an open door for bacteria, and if you have impaired glucose metabolism, meaning elevated blood sugar, what seems like a minor fungal nail problem can cascade into life-threatening complications. Time equals 1 second / greater than. We are talking gangrene of the foot, not an exaggeration. Statistics. Every year, hundreds of thousands of lower limb amputations are performed, and a significant number begin with a fungal infection that someone decided was not worth treating. The second cause of yellow nails is more systemic. There is a condition in which all 20 nails, fingers and toes, turn yellow simultaneously, thicken dramatically, and grow extremely slowly, while the cuticle nearly disappears. At the same time, the patient develops swelling in the lower legs and chronic problems with the respiratory system, the airways. 3 symptoms, 1 thread. A failure of lymphatic drainage. The lymphatic system is the body's network of vessels that removes excess fluid and metabolic waste from the tissues. When it breaks down, everything suffers. Airways, peripheral tissues, growth zones. Yellow nails here are not a cosmetic flaw. They are a manifestation of a systemic failure called yellow nail syndrome. Blue, gray, or violet nails. Remember those capillaries beneath the plate? When blood oxygen saturation drops, when there is not enough oxygen getting into the red blood cells, hemoglobin darkens, and that darkness shows through. Blue nails are a classic sign of tissue oxygen starvation. The causes include chronic obstructive pulmonary disease, that is, a lung condition where the airways narrow and air cannot move properly, severe bronchial asthma, congenital heart defects, and severe anemia. One more. Certain medications used to control heart rhythm, called antiarrhythmics, can produce the same effect. If you are taking antiarrhythmics and you notice bluish discoloration, tell your doctor immediately. Do not wait for your next scheduled visit. Green nails are less common, but alarming when people see them. The usual culprit is Pseudomonas aeruginosa, a bacterium that thrives in moist environments. Dishwashers, anyone whose hands spend significant time in water, is in the risk group. The green color is a metabolic byproduct the bacterium produces. It is not immediately life-threatening, but without treatment, the infection progresses deeper. Now, pay attention. This is the most important color finding I am going to describe. A dark, longitudinal stripe, a narrow brown or black line running from the base of the nail to the tip, may appear on a single finger. In most cases, particularly in people with darker skin, this is completely normal. Activation of pigment-producing cells in the matrix. But there is an aggressive form of skin cancer that develops specifically beneath the nail plate. It is called acral lentiginous melanoma. It is dangerous precisely because it masquerades as a harmless streak for a long time. The warning signs that should send you to a dermatologist today, not tomorrow, not next week, today. The stripe is wider than 3 millimeters. The edges are blurred. The color is uneven, and the pigment has spread beyond the nail onto the skin of the finger itself. Any of those features demand immediate evaluation. Early detection is literally the difference between life and death. Color is only half the picture. Shape is the other half. And some changes in shape are specific enough that an experienced clinician begins forming a diagnosis the moment they glance at your hands. Put your hand flat on a surface and look at your fingers from the side. A healthy nail has a gentle outward curve, a shallow arch. If instead you see a concavity, a dip in the center like a tiny spoon, that is called Koilonychia. It almost always signals a significant iron deficiency. Iron is directly involved in building keratin structure. When iron falls short, the fibers do not stack properly, and instead of an arch, the nail develops a hollow. Here is what is remarkable. Spoon nails can appear before iron deficiency shows up in a standard blood test. The body protects hemoglobin levels as long as possible by redistributing iron reserves, but the peripheral tissues starve first. Your fingers are ahead of the laboratory. Koilonychia also develops after years of exposure to harsh chemicals, bleach-based cleaners, solvents, acids, without protection. These agents break down the sulfur bridges holding the keratin layers together and buckles inward. Gloves are not a recommendation. They are a requirement. Without them, after 5 to 7 years, you are looking at irreversible structural damage. Now, the opposite. A nail that is excessively convex, domed, rounded like a watch glass attached to a fingertip that is itself thickened and club-shaped. This finding was described by Hippocrates 25 centuries ago, and clinicians still call it clubbing, or Hippocratic fingers. In certain diseases, primarily pulmonary and cardiac, substances are released into the bloodstream that stimulate the growth of soft tissue around the distal phalanges. The distal phalanges are the last joints of your fingers, the ones at the very tips. Capillaries expand. Connective tissue swells. The fingertip thickens. The nail arcs. What conditions produce this? Lung cancer in 35% of cases. Pulmonary fibrosis, scarring of the lung tissue. Empyema, pus in the chest cavity. Congenital heart defects. Cirrhosis. Inflammatory bowel disease. Every item on that list is serious. There is a quick test you can run right now. Press the nails of matching fingers together. Nail to nail of 2 hands, same finger. If you see a small diamond-shaped gap between the bases of the 2 nails, that is normal. If the nails press flush with no gap at all, that warrants a medical consultation. It is called the Shamroth sign. 3 seconds. Remarkable clinical accuracy for something you can do at home. The surface of the nail tells its own story. Hold your hand under a good light and look closely. Most people over 50 will see longitudinal ridges, thin lines running from base to tip. In most cases, this is simply aging. The matrix begins to work less evenly over time, like a printer that has developed a slight paper feed irregularity. By the time a person reaches 70, virtually everyone has them. But if ridges appear suddenly, over a period of months, not years, or if 1 or 2 ridges are dramatically deeper than the rest, that is not age. That points to B vitamin deficiency, malabsorption in the small intestine, or rheumatoid arthritis beginning its attack on the small joints. Transverse grooves are something entirely different. Deep horizontal furrows running from one edge of the nail to the other. These are called Bowes lines, and every one of them marks a moment when the matrix temporarily stopped working. A high fever illness, major surgery, chemotherapy, extreme psychological stress. The body diverted all resources to survival, and nail growth paused. When the crisis passed, growth resumed, but the groove remained. And here is the remarkable part. You can calculate when the event occurred. The nail grows at a rate of roughly 3 to 4 millimeters per month. Measure the distance from the groove to the cuticle. Divide by 3, and you get the approximate number of months ago it happened. Retrospective diagnosis from a physical measurement. Elegant and unsettling at the same time. One groove means one isolated episode. Multiple parallel grooves mean recurring crisis. Grooves on all 20 nails simultaneously mean the whole body took a systemic hit. Many people who went through a severe viral illness in 2020 developed characteristic transverse grooves 2 to 3 months afterward. The body recorded the battle the way a seismograph records an earthquake. Every line, a spike on the chart. There is another finding most people walk past entirely. Tiny pits on the surface of the nail, as if someone pressed a pin into it repeatedly. They do not hurt. They do not interfere with daily life, but they are loud. Multiple pitting across several nails is one of the earliest signs of psoriasis. Psoriasis is an inflammatory skin condition where the immune system attacks the skin's own cells. The nail pits can appear years before the first skin plaques show up elsewhere on the body. Your fingers are warning you about a disease that has not yet surfaced anywhere else. The same pitting pattern occurs in alopecia areata, a condition where the immune system mistakenly attacks hair follicles and often strikes the nail matrix at the same time. Scattered pitting plus surface roughness equals 2 autoimmune processes sharing one mechanism. Now, 3 words that people use interchangeably, but that describe 3 distinct diagnoses. Brittle, peeling, crumbling. When a patient sits down in my office and says, "My nails are bad," they use one of those 3 words. And in 90 out of 100 cases, they are treating them as synonyms. They are not. Brittle nails are dry, stiff, inflexible, and crack under pressure. The medical term is onychorexis. The primary cause is hypothyroidism, a sluggish thyroid gland. The thyroid regulates metabolism in every cell in the body, including the matrix. When thyroid hormones fall, keratin production slows, and the plate becomes rigid and fragile like dried clay. The second cause is chronic dehydration. As we age, the brain's thirst center becomes less sensitive, and people regularly drink less than they need without realizing it. Nails are among the first tissues to lose moisture. Simply increasing water intake to around 50 to 60 ounces per day can produce a visible difference within 2 to 3 months. Inexpensive, simple, and it works. The third cause is external aggression. Acetone-based nail polish remover, alkaline cleaning products, and especially alcohol-based hand sanitizers. Using sanitizer 5 or 6 times per day over several years is a reliable recipe for brittle nails. Peeling nails split at the free edge into thin horizontal layers, like mica. The medical term is onychoschizia. This often traces back to the digestive system. Impaired absorption of fat-soluble vitamins A, D, E, and K depletes the lipid layer that bonds the keratin sheets together. This happens most commonly with chronic pancreatic inflammation. When the pancreas does not produce enough enzymes to break down dietary fat, the person eats a normal diet and still does not absorb what they need. Strict, low-fat diets in people obsessed with cholesterol management produce the same result. Dietary fats are not just for cardiovascular health. They are needed by your skin, your joints, your brain, and your nails. Peeling plates are often the first sign something is wrong with fat absorption. Crumbling nails disintegrate. The plate becomes porous and chalky. Most often, this is advanced fungal infection, onychomycosis. Fungal nail disease penetrates deep into the plate, turning hard keratin into a loose, spongy mass. But the more dangerous version is dystrophy, caused by peripheral vascular disease. Narrowed vessels from smoking, diabetic arteriopathy, or atherosclerosis starve the matrix of oxygen and nutrients. It produces defective keratin. Soft, crumbling, structurally useless. One phrase, bad nails. 3 completely different biological mechanisms and 3 different treatment approaches. Now, a zone that almost no one examines. The skin around the nail plate. Hangnails, those small, painful tears of skin at the side of the nail, if they appear repeatedly despite good care, they are a marker. Zinc deficiency. Zinc is a trace element critical for skin integrity, wound healing, and immune function. When zinc is low, the skin around the nail tears easily, inflames, and refuses to heal. The second cause is low stomach acid, a condition that becomes more common with age and is dramatically underdiagnosed. Time equals 1 second/greater than. Without adequate stomach acid, the body cannot absorb zinc, iron, or vitamin B12 properly. One digestive problem creates a cascade. Poor acid production, deficient nutrient absorption, hangnails, brittle nails, paleness. The whole picture connects. Inflammation of the cuticle, redness, swelling, tenderness at the nail base is worth taking seriously when it persists. A single episode after a rough manicure heals on its own. Chronic inflammation across multiple fingers that does not clear up in weeks can be an early manifestation of dermatomyositis, an autoimmune disease in which the immune system attacks its own muscles and skin. The capillaries at the nail base become enlarged and distorted into a visible pattern. General redness is obvious even without magnification. In modern rheumatology, there is a growing diagnostic technique called nail fold capillaroscopy. A specialist examines the tiny blood vessels at the base of the nail under magnification. In a healthy person, they form neat, uniform loops, regular, consistent, orderly. In systemic autoimmune diseases, scleroderma, lupus, polymyositis, the picture changes. Vessels dilate, deform, and some disappear entirely. This method can detect disease at its earliest stages, before any other symptoms have appeared. The nail fold is an accessible window into the microvascular system. A separate chapter is Koilonychia, infection of the lateral nail fold, the skin at the side of the nail. The finger pulses with pain, turns red, swells, and may discharge pus. Acute Koilonychia is bacterial, almost always triggered by trauma or a cuticle manicure. Chronic Koilonychia is often fungal, specifically Candida, the same yeast responsible for other types of infections, and it is most common in people whose hands are constantly wet. Chefs, bartenders, healthcare workers. There is an important catch. Chronic Koilonychia that does not respond to treatment after 6 to 8 weeks can be masking squamous cell carcinoma, a skin cancer that develops in the tissue around the nail. If the inflammation keeps coming back, if it does not respond to standard treatment, biopsy is not optional. It is mandatory. Look at the underside of the free edge. If a gap has opened up between the plate and the nail bed, if the nail is lifting away from the tissue beneath it, That is called onycholysis. Common causes include trauma and chemical irritation, but also hyperthyroidism, psoriasis, and a reaction to tetracycline antibiotics. A person takes the medication, goes out in the sun, and ultraviolet light literally detaches the plate from the nail bed. Almost nobody connects those two events. The connection is direct and well documented. If you are on a tetracycline and your nail starts lifting, call your prescriber. One of the most underappreciated parameters in nail assessment is growth rate. Here is a fact that surprises even clinicians. Nails grow approximately 15 to 20% faster in summer than in winter. The reason is improved peripheral circulation in warm weather and higher vitamin D levels from sun exposure. That is normal seasonal variation. Time equals 1 second / greater than. But when growth rate deviates from the individual baseline for pathological reasons, it becomes diagnostic. Slowed growth, less than 2 millimeters per month. Hypothyroidism. The thyroid regulates the pace of every biological process, and when it slows, everything slows with it. Poor peripheral circulation from atherosclerosis, Raynaud's phenomenon, or decades of smoking. The matrix receives less blood, less oxygen, less fuel. Normal aging. After 60, growth rate declines by roughly 0.5% per year. That is physiological and unavoidable, but worth knowing so you do not confuse it with a pathological slowdown. Accelerated growth is not always a good thing. Hyperthyroidism drives metabolism into overdrive. The plates grow faster, but they are thinner, softer, and deform more easily. Psoriasis also accelerates growth. Immune cells stimulate the matrix. The result is a thickened, ridged, distorted nail that grows quickly, but is structurally compromised. Quantity is not quality. One more detail worth knowing. On your dominant hand, nails grow 5 to 10% faster than on the other. Right hand for right-handers, left for lefties. The mechanism is simply better blood supply to the more active limb. The middle finger has the fastest growth of all. Longest finger, best vascular perfusion. The little finger has the slowest. If you have noticed that you trim your pinky nail less often than the rest, now you know why. Asymmetric growth between the two hands that exceeds the normal dominant hand variation is worth investigating. Stenosis of the subclavian artery, a narrowing in the blood vessel that supplies the arm, and thoracic outlet syndrome are conditions where blood flow to one limb is restricted. On the affected side, nails grow more slowly. The plates are thinner and paler. Comparing your two hands takes 3 seconds and requires no equipment. If growth slowed significantly after an illness or injury and has not recovered in 3 to 4 months, the body has not fully recovered either. A smoldering inflammatory process, or chronic stress, may still be suppressing regeneration. Nails are a speedometer for recovery. If the needle is not moving, something is still wrong. Everything we have covered so far is about your hands. Your feet are a separate universe. Different rules, different dangers, and most people never examine them at all. When did you last look? Really look. With good light, with your socks off, taking your time with each toe. The feet are the farthest point from the heart. That is exactly why the earliest signs of vascular disease show up there first. Nail thickening on the feet. Toenails are naturally thicker than fingernails, and they grow about 3 times more slowly. Full replacement takes 12 to 18 months. When a toenail grows so thick it begins to resemble a claw, a condition called onychographosis, the most common culprits are chronic venous insufficiency and advanced fungal infection. In venous insufficiency, blood pools in the lower legs instead of returning efficiently to the heart. The tissues are oxygen deprived, and the matrix produces abnormal keratin, dense, curved, yellowed. As for fungus on the feet, it has ideal conditions: warm, dark, moist. Closed shoes, synthetic socks, perspiration. Left untreated for 6 months to a year, the nail transforms into a crumbling, distorted mass. Here is what is critically important. If you have impaired glucose metabolism, if you are diabetic or pre-diabetic, fungal nail infection on the feet is not something to manage later. Any crack in the skin, any break in the barrier, is an entry point for bacteria that can end in amputation. The statistics are not abstract. Hundreds of thousands of lower limb amputations occur every year in the United States. A significant percentage begins with a fungal infection that the patient decided was merely a cosmetic problem. Ingrown toenails. The edge curves and grows into the surrounding tissue. Pain, inflammation, sometimes pus, difficulty walking. The most common cause is technique, rounding the corners of the nail when you trim it. That rounding, which feels natural, is exactly what drives the edge into the skin. The correct method is to cut straight across, leaving the length slightly above the level of the skin, with no rounded corners. The second cause is narrow footwear compressing the toes. The third is genetic predisposition. Some people have a natural curve to their nail plate that makes ingrowth nearly inevitable without consistent preventative care. Here is a clinical sign that almost nobody outside of emergency medicine knows about: capillary refill time. Press on the nail plate of your big toe until it turns white, then release. The pink color should return in under 2 seconds. 2 seconds or more, and blood flow to that toe is impaired. Emergency responders use this test routinely to assess circulatory status. You can run it at home every single day in under 5 seconds. Under 2 seconds, normal. Over 2 seconds, check your circulation. Cold feet, pale nails, slow growth, recurrent fungal infections. If 3 or 4 of those are present at the same time, that is a serious reason to investigate arterial blood flow. The test is called arterial duplex ultrasound. It is non-invasive, painless, and widely available. It shows exactly how freely blood is moving through the vessels of your legs. Here is something worth noting. The vascular risks we have been talking about: onychographosis, circulation problems, fungal complications, all of them accelerate with age. After 55, the rate of these processes roughly doubles. How old are you? Write it in the comments. I want to see who is watching this channel. Will help me choose which topics matter most for the next video. Now, we have covered an enormous amount of ground. Time equals 1 second / greater than. Dozens of signals, from white spots to capillary refill time. I understand that might feel like too much to hold at once. So, here is a practical system. 8 steps, 5 minutes a week. This is what I actually want you to walk away doing. First, examine in proper light. Natural daylight is ideal. Standard household bulbs distort color. You can miss early yellowing or blue-gray tones entirely. Remove nail polish. If you wear gel coating, take it off completely at least once a month. An opaque layer can hide a process that is quietly progressing beneath it. Second, color. Examine every plate on both hands. Pink and even normal. Yellow, fungal infection or systemic process. Blue or gray, oxygen issue that needs evaluation. Pale across the board, possible anemia. Dark stripe, dermatologist today. Do not diagnose yourself. Document and photograph once a month on your phone. In 6 months, you have a visual timeline to show a clinician. Third, lunulae. Are they visible on at least your thumbs? Have they changed in size recently? Disappearance of the lunulae is a reason to get a complete blood count and a thyroid panel. Fourth, surface. Run the fingertip of your opposite hand across each nail. Smooth, longitudinal ridges, horizontal grooves, pitting. Anything that appeared recently deserves attention. Fifth, shape. Concave or excessively convex. Run the Shamroth sign. Press matching fingers together, nail to nail. Diamond gap? Fine. No gap? Schedule a visit. Sixth, structural integrity. Apply light pressure to the free edge. Does it flex with resilience, or does it crack, peel, crumble? Brittle points to thyroid or hydration. Peeling points to fat absorption. Crumbling points to fungus or vascular disease. Seventh, perimeter. Hangnails, redness, swelling, tenderness around any nail. Chronic inflammation on multiple fingers is a reason for evaluation, particularly if you have any other joint symptoms. Eighth, feet. Socks off, good light, leaning in. Thickness, color, fungal changes. Capillary refill on the big toenail over 2 seconds, vascular workup. 8 steps, 5 minutes. Compare what you see today to what you observed last week. Photograph it. Write it down. Treat this with the same seriousness as checking your blood pressure or your blood sugar. Your fingers know as much about your health as a blood pressure cuff does. The body gave you a free diagnostic instrument that runs continuously, requires no batteries, no subscription, and no appointment. It is working right now, at the end of your hands. Use it. If this video helped you, send it to someone you care about. A parent, a friend, someone who might be ignoring a signal right now that they did not know meant anything. You may have just given them a real chance to catch something early. What you just heard is not what you will get at a standard clinic visit. There is no financial incentive for a system to keep you out of the waiting room. Leave a comment with the number 1 if this video was helpful to you. I would love to hear from you, and know that this information made a difference.